What if everything you thought of health and wellness suddenly changed due to a hidden breathing problem that you were unaware of that affects every system in your body? Improper breathing habits are often overlooked in medicine. I'm Dr. Jenny from the Hobson Institute, and this is the Breathing Lab.
We are live. Welcome, everybody. We have our wonderful hosts, Dr. Jennifer Hobson and Dr. Martha Cortes, and they have two incredible guests today, which I'm going to let them introduce their guests. I am just here to fill you guys in and listen and learn with you all. So welcome, everybody. You guys can take it from here.
Martha, you want me to introduce Cynthia?
Yes, that would be wonderful.
Hi, everyone. This is, I'm Jenny Hobson, Dr. Jenny, if you want to call me Dr. Jenny. I'm a physical therapist, and I'm a TMJ head and neck PT that does myofunctional therapy and Vertigo. I have the pleasure of introducing Cynthia Stein. She is a fellow physical therapist that has been dedicating her career right now to nasal release technique and really spreading the word around the airway professionals around this amazing technique. So Cynthia is here. Welcome, Cynthia.
Thank you.
Yes, and then Martha, do you want to introduce Miss Sweet Karen?
Oh, Karen. Okay, interesting, because Karen and Cindy have come into my life each time when I realized there was something that was off. So Karen Davidson, actually, I met her on Clubhouse because of Airway Circle. And I had just spoken the word saying, oh my God, it's the nasal, but how am I going to measure the nasal? And that's why we really have come into this whole space is, what about nasal function? And this is what Karen Davidson now. Karen, could you kindly open up your mic and give us a little 1 minute gist of yourself? Because you are something else. Your credentials are unbelievable.
Thank you, Dr. Martha. Good evening to everyone, and thank you for attending. So I do have a vested interest. I came to GM over 5 years ago, and through this position that I work with them, I've had the opportunity to really have an inside look to the guts, so to speak, of Rhinomanometry, and learn this every single day. So over the past, almost 5.5 years of working with it and research, I've uncovered the biomarker of transnasal pressure changes. And Dr. Martha will show how this really affects different therapies. But my background has been in nursing. When I grew up, I thought I wanted to be a nurse practitioner, then a CRNA, but here I am. And my background in doctor is in healthcare administration and health policy, but I'm an advanced practice nurse by trade.
And you're an ENT, and you have a history of ENT, ear, nose.
So I've been in the medical industry, the medical device industry for over 26 years, but specifically in the ENT world to some level since 2001. So it's been 21 years.
Oh, Cindy, wow. Now, Cindy is a physical therapist who became very involved in nasal. And from nasal function, she became involved with concussions because you can't separate them. And that's what this is about. But let's start with a simple thing. Are we all good?
Yeah.
All happy? Cindy, would you like to say anything else about yourself that I might have missed?
Well, I'm ex-Navy, and I had a private practice in Pittsburgh for many years. And now I'm devoted, I sold my practice. I'm now devoting my time to teaching nasal release technique. And I see some patients privately. And I'll tell you, this work is truly amazing. And the people that have come into my life recently, Dr. Martha and Karen, and I've known Jennifer for 7 years. They've added such incredible stuff to my work that it's just even more exciting now.
So this is just a little picture of nasal function. I lost it. Come on. Okay. And this is what the NR6 looks like. And essentially there's a mask, but first there is a measuring tool that gets put, you plug in one side of the nose, And then you measure the actual breathing through the nose, and it'll pick up when they're mouth breathers. And these are different views. This is a filter right in the middle, and this is the mask. It's a very simple, because this is about simplicity, he's talking about it. Now, when you get the test, there's 2 gold posts, and the gold post is where the higher levels, the 800 cc's, the flow rate. The equator is where you're going to, I call them the flatliners, because that's where the apnea is going to show up. You see the red in the middle right here? Well, it matches with the algorithm that Dr. Karen has put together. The red talks about apnea. So we have found a lot of children are actually severe apneic despite being mouth breathers. That is a big deal. And they need so much more than, oh, maybe we should open them a little bit. And I started actually realizing now doing measurements. Whoop. And you see their flatliners. This person is severe apneic mouth breather. Horrible. Now, if you look at these measurements down here with the arrows, those 4.2 and 5.8 supposed to be just 0.2. That's what normality is. So this person was in severe problems, and they only thought they had crooked teeth. So I opened up their transverse palate here and here. Here you can see that it's opened, and I do it with a skeletal maxillary expander. So there's many implants into their oral cavity, onto their bone, opening up the nasal, which is why I seek something to measure the nasal. I realize it's the nasal, but you got to open up the nasal if you can with the opportunity of the oral cavity. This is how it's improved. This is a measurable in 6 months. Measurable. They actually are now breathing more in the green versus the red. They no longer are apneic. So then I start asking, okay, so we are able to open the nasal. See how the black spaces are opening? There's the big C's near the turbinates. It actually is opening it. This is not nasal surgery. This is opening it up. And we were able to gain breath. So it's the nasal.
Wow.
It's the nasal.
That image, go back one more time. And Martha, really? That's how
Really?
much the MSC opens up the
Yeah.
nose?
You really.
Wow.
And this is nothing. This is a 39-year-old. This is what I'm not supposed to be able to do. The 45s and the males are harder, but you still got a little out. You got to puncture, got to create little punctures like basting. Got to little by little. It really is a big deal. So what happened, I started asking the question, oh my God, is the nasal? Is there another method? What about all this that I've expanded? Is there another method that we can address the nasal without having to put the prunks? Because that nasal is connected to the maxilla. It's connected to the eyes. That's sphenoid. And that sphenoid is connected to the occiput, where we get our cranial rhythm. So all these are connected. Can we do something? Cindy, can we do something?
Can we do something? Yes.
Absolutely.
Yes, I think if you do this technique before you do anything, it'll help the expansion that you're doing.
So why don't you talk about the technique? I own, if you, the slides is about the actual maxilla sphenoid, then at the end, then we can go on to how it affects, how nasal release can affect in concussions.
The technique uses a blood pressure bulb with a finger caught affixed to it. We do 8 insertions. You go below the first turbinate. That mobilizes the maxillary and palatine suture. You go 45-degree angle above the first turbinate, in between the first and second turbinate. That mobilizes the zygoma. And then you go up and back, and that mobilizes the sphenoid, which is the third position. And then we go back down and we redo the lowers again to push everything back down.
So here are the lower ones. Here are the middles, and
Mhm.
here's up here in the sphenoid area. Now, here is the maxilla. So do you have anything you'd like to say here?
Well, I mean, we know that when we directly mobilize the maxilla and the palatines, you're indirectly moving, I don't know, 10 other bones. It's amazing how many bones articulate with those 2 bones. But Stober, who really pioneered this procedure, he was a naturopath and a chiropractor. He said that the palatine really is the brake, and that it's very important to get that palatine back into the right position. If a baby doesn't have a good suck reflex, typically it doesn't get pulled back down. And so that's why nursing is so important, and the baby's sucking should be very strong so that they can actually mobilize the cranial bones, particularly what you see there, the palatine.
Huh. So the palatines are higher up and then the sucking brings them down?
Yes.
I did not know that. Huh, they're up and then,
It's like this, and then it should be like this.
okay.
Very
Now,
Now that was Stober's theory. Whether it's right or not, who knows?
it makes sense
But it
though.
makes sense.
Yeah, now here's the first insertion, which would be the inferior concha. Why does it affect the maxilla? Like I know some patients, okay, I have a 14-year-old, she got numbness in the front teeth. I go, oh yeah, that's one of the side effects. A little bit of numbness, pressure up in here, and loved it because for the first time they could breathe.
Now, when you think about it, when the balloon goes in, it's actually pressing down against that suture and the palatine and maxilla bone. So, and you have to get it to move into the nasopharynx in order to really get the procedure to be done properly.
Meaning that it goes through the concha to the back?
Yes, to the back of the throat.
Got it.
That
'Cause
the teeth sensitivity, like just feeling like your teeth ache a little bit, there is movement there, right? I mean, like you're creating a change in that mid-palatal suture,
Yes.
right?
Yes.
So
Yes.
it's very common to have that sensation that your teeth kind of hurt a little.
Well, you actually hear cracking when it's done. You feel the bones moving. They crack.
Yeah.
well,
And we
you
know that the sutures have vascularization. They're not fixed.
so does the ligaments around the teeth. So an osteopathic way of doing osteopathy is to take the tooth and go back and forth, mesial distally, back and forth, and then buccolingually like this, and you're actually doing a cranial sacral suture expansion. So this, I noticed, did it. Yeah, that was amazing. It's been
That's why
amazing.
children, before they get braces put on, need to have this procedure.
When
Because
this-
you're only fixating cranial dysfunction if you put braces on.
So I did the nasal after doing the, I'm done. I've expanded. They were really, really awful originally, and they were torqued. It was one of those cases where the posture was unbalanced, the pelvis was off, the links were knocking, and the arches were collapsing. It was one of the hardest. And at the end is when I finally got the nasal, because that's when I got it. That's when I was able to do it. And both the mother, remember how you said, make sure you do the mother?
Yes. Are you talking about the girl that I saw in
Yes.
your office?
Yes.
I'll tell you, she worked miracles on this girl. I could not believe how crooked her teeth were at the beginning. It was amazing.
Because they can't breathe through their nose. So what happens, they have, a lot of them end up with these teeth are like 123 degrees. It's supposed to be 110, 123 degrees, and they like little birds. And the reason is because they can't breathe. So you look at the teeth and you go, oh my God, that is horrible breathing. You just don't straighten out the teeth. You got to
And the
get
mother had the same
Right.
problem. You could
Oh,
see where it came from.
hereditary. So we got the palatines. Tell me more about the zygomatic. That's into the middle concha.
Well, again, Stober seemed to feel that the second insertion moves that, when you're going at a 45-degree angle, it moves the zygoma. The zygoma only articulates with 4 bones, unlike the palatines and the maxilla and the sphenoid. It doesn't articulate with as many bones, but it's still very important because you see so many people that have asymmetry there. A zygoma will be higher than the other. The face can be more prominent in one side than the other. So that second insertion really takes care of getting that alignment back
It
in the
balances
zygoma.
the cheeks.
Yes.
And then therefore the eyes more too, even though the next one, okay, the sphenoid.
Really the cornerstone bone. And you have to remember 5 of the 6 extraocular muscles. This is part of the reason in concussion, we see restrictions in eye movement in concussion. And when you examine the eyes, you can actually tell that how the sphenoid is out of whack because 5 of the 6 extraocular muscles attach there. One of the extraocular muscles, the inferior rectus, attaches from the eyeball to the maxilla. So when you get this bone, the sphenoid, not only are you changing the position of all those muscles and getting them better so that they can work properly, you're also tweaking the pituitary, which sits on top of the central portion of the sphenoid.
And then all those cranial nerves that come off at the base.
Yes. Yes.
All those torsions, when the sphenoid is torsion, all those cranial nerves are torsion. And it's like some people come in with phantom pain. They go, I have numbness behind this and behind. This is before the nasal release. And it is the torsion, the sphenoid, and in the neck that's compressing those nerves. That's neuropathic numbness. But then you have to untorque them.
And you also have to remember, when we go in, it's very difficult in osteopathy to treat the sphenoid externally. When you when you go into the nose, you are getting the very deep circuitous sutures of that bone. And you're opening up an area that generationally has never been moved. And so you not only do you get a lot of anatomic changes, you get a lot of emotional changes, and then you also move stuff, what I would call spiritual stuff, what you've inherited. And so you see a lot of stuff happen immediately when you move that bone.
Unbelievable. So
Can I
these
just
are the other
mention one thing
articulations.
about the
Karen can
eyes,
tell you
though?
that because I did it on her, and she Karen, why don't you talk about your experience with it? It was like amazing.
So this is my analogy. I say, I've never done a drug in my life. I've never done any shenanigans, anything I shouldn't be doing. And this was the most euphoric thing I've ever done in my life. When I was on my kitchen table, literally on my kitchen table, getting this done. And within 30 minutes, I started crying. And then my teeth hurt. And she said, "You've had braces." And I said, "Yes, twice." And it was the most amazing thing. And let me just tell you, I think this affects the pineal gland, because when I need to sleep, I sleep so well. Like the melatonin is rushing out of the little pineal gland. I don't know if that has anything to do with it. Is it kind of anecdotal, or do you see that?
I've seen a lot of hormonal changes with this technique. Yes.
Yeah.
I've
Brilliant.
seen women that have amenorrhea. I've seen their periods come back. I saw a person that had chronic gut issues, diarrhea, and weight loss. She got better from it. Those were concussed people, by the way. And which is mostly what I deal with. But the beauty of this is that a new realm is opened up for the work, which is the dentists. You know, and I've always said they should be doing it, and now it's getting out there, so it's beautiful.
Well, Jennifer had a question, Dr. Jennifer.
No, I was just gonna say, the eyes. You're writing, this slide about the eyes. I've been so impressed with this technique around, testing eyes, testing the eye tracking and the movement of the eye. I know what Cynthia trains us to do is, put the patient against a wall, keep them kind of stable, and have them not move their head at all. And you will find one restriction of an eye movement that causes a little bit of a strain or discomfort, sometimes even pain. And if you do the technique where it releases these bones, especially the sphenoid, that last position, that third position on both sides, it will really, if you put your eyes in that position and then do the release, 9 times out of 10, the patient has much less eye strain post procedure. And
that's the reason. That's the reason, Jen, that in concussion care, there is eye strengthening that's done. And in 80% of the people that do the eye strengthening, they get better. 20% don't. And the reason is they're just too jammed
up. Right. So that's all I wanted to mention, because I don't think everybody understands what this technique does, but the eyes are so connected to this bone, and if this bone's out of position because of whatever reason, maybe it's a cranial strain. Like never had a concussion, and I have a cranial strain. I have, I've got a torsion. One ear's a little higher, one eye's a little higher, and that's all the sphenoid bone adapting to the way my face grew, because I was tongue-tied, breathing through my mouth, and very high narrow palate. So all of that shifted me. And There's one side of my nose that will crack, the other side doesn't. So that one side's jammed, compressed, and all of it releases in such a way, because I also do cranial osteopathy and that type of functional manual medicine where you're doing sutural work, which I know Cynthia does. My office is, in Chicago is really a head and neck clinic. It's specialized in doing all this exterior work, but doing the nasal release on top of doing this, functional manual medicine or osteopathic manual medicine. It's like, it's such a great way of releasing the compression that we all tend to have in our heads. And those of you that clench, and there's many of our patients, if you're in the airway world, clenching's already been linked to restricted nasal flow and issues with breathing through your nose, that you are going to clench to help open up your not nasal passages in particular, but just breathing in general. And this will help open your cranium and really release that compression. So that's all I wanted to say.
And Cindy's going to speak a little more about what you just said, but why I'm giggling is because I've expanded so many people and they're all on maintenance. But the nose, some have had surgery in their nose. Some of them have had Dr. Hobson with all the clinic and all the exercise. And they're like, oh my God, one more thing. I said, no, this is it. Because you still have that residual clenching. Why? You still have that residual grinding. Why? Oxygen desaturation. There is a problem of oxygen getting to the brain. We need to open your nose. No more surgery. No surgery. So I've been now doing the nasal release on them. And that was the touch.
Oh, thanks,
And
Martha.
I
wanted to say, go ahead.
Go ahead. No, go ahead.
I wanted to say something. You cannot separate neck movement from the eye restriction. You cannot separate the jaw. So once you find the eye restriction, so let's say, for example, it's looking up. I then look at all the neck movements and see what neck movement increases the eye strain. And typically there is one or two that will do that. Then the third thing I do is that I have the person open their mouth up as wide as they can and put their eyes in the strain position and their neck in the strain position. And we can tell if the jaw position increases eye restriction. And then the last thing, and I just discovered this, you want to look at the tongue, because the tongue is connected to the dural tube. So I put the eyes in the restricted position, I put the head in the restricted position, and then I have the person stick their tongue out as far as they can. And typically it will increase the eye strain if there's a dural tube restriction.
Excellent.
So it's really interesting. You can't separate it.
Can't separate it.
All works together.
And that sphenoid right here says a lot, because if that sphenoid is twisted, now the eyes are on top of the sphenoid and the pituitaries. That's a big deal. That sphenoid is a big deal. And then the maxilla is right there, right in front of it. So let's go to the next one. There's your right.
Dr. Martha, I just share something real quick. This is the power that physical therapy and dentistry has with nasal release, because a personal story, my stepmom had a sleep study done. She sent me the results. And what did they do? They gave her CPAP. I said, Mama, it's not going to work. You're above the threshold of nasal resistance with rhinomanometry. You have a posture problem. You have scoliosis. You have a C-spine issue. It's not going to work, but okay. She had nasal release done by one of Cindy's students, and that was in May. 2 ENTs want to do surgery on her. And I said, no, Mama, no ENT surgery. Has a nasal release technique done. 3 months later, she can still breathe nicely. She has an oral appliance from her dentist, and she's happy and sleeping well.
That's wonderful.
That's a beautiful story.
It's amazing. We're taking work away from the ENTs. I
Not
hope
necessarily.
there aren't any
There's
ENTs on this
No,
call.
no, we really are not, because some of these candidates would not have done as well anyway.
Yeah.
There's plenty of work. There's plenty of thought patterns. It all depends who is your network, who are your mates, Who are you living with? Who are you thinking with? And the patients are also attracted to that. So I have some patients go, I understand you're, they're coming now and saying, I understand you're doing something with the nose. You're expanding, but you have implants that you put in, but now there's something else. I'm going, already, you know, they go, yeah, we know, we heard. So
Wow.
these are some of the things. It's interesting, but it's little at a time. It's the nasal. I'm sorry, it's our breathing. What else is there? So these are the symptoms that may respond. Can you speak about that?
These are the only ones that I put down. I don't like to put other things. Some people put a lot of stuff. There are other things that it helps, but these are the biggest things that it really shows good results with, particularly post-concussion symptoms, facial pain and pressure headaches, sinusitis, unbelievable. When I had it done on I have not had a sinus infection in 10 years. I used to have a yearly sinus infection. It also helps neck pain and snoring. So
You did not put TMD on here, and that's something that I mean, I use it a lot for my real bad clenchers, the ones that all have airway compromise, and it really helps them. So
well, I'm going to have to add it, Jennifer. I'm
You can
sorry
have
I
it.
didn't get that. You just pointed that out.
yeah, I think, because I mean, in the airway field, people have to know that it's like the snoring sleep apneics, they all tend to have issues with clenching, some of them, not all of them, but a lot of them, and they compress their head. So this just opens things up. So I think you should add it.
And there are papers that talk about the TMJ and nasal, and Dr. Karen's the one who introduced me to those papers, where the nasal dysfunction was part of that TMD world.
Yeah.
So all these appliances, we need to open up the nasal, not just put appliances automatically, get them breathing through their nose, get them having the correct neck position, the correct posture, but not just constantly be putting plastic between their arches. And I'm a dentist. Okay, what is the next one? Contraindications.
Yeah, I just recently, I put a few new ones on here. I used to have a much smaller list. I had a student call me up and said that he did somebody that was a cocaine abuser, and the person had a massive nosebleed. So we really have to ask that question. Have you been snorting cocaine?
So you have to look in, and if the septum is too thin, you can see it, or there's a tiny hole, that is not a candidate. My husband, who's brought up, that was the first subject. He goes, you got to make sure they're not doing too much cocaine. You got to make sure that septum is solid versus just a thin little thing. I was like, wow, I never thought of that one. Yeah. So hemophilias, blood thinners.
You should ask that. And again, if the person is on blood thinners, you want to make sure they lubricate their nose for a few days with Vaseline, just to make sure that their mucous membranes are supple. And the problem would be is if they have a nosebleed, it would be difficult to stop it. But I haven't seen it. I've seen nosebleeds, but I haven't really had a problem with people on blood thinners because I'm always careful.
Yeah, aneurysms.
I'm sorry, aneurysm. Well, I've treated people that have had strokes.
Strokes, I'm okay, yeah.
Again, aneurysm, you don't really know unless the person has been scanned if they have an aneurysm. But I haven't had anybody stroke out on me after I've done the procedure.
Severe cranial osteoporosis, how would you know?
Well, if the person has osteoporosis, I would start them very gently and ease them into the procedure. I've treated my mother, who is 96 years old, and she's been fine with the procedure.
Good.
So.
Changing mucosal lining, emotional instability. How would I know?
Well, you got to if you have a gut feeling about the patient, you
go there.
Stay away from them.
Now,
people can get funny if they get freaked out by stuff.
So one thing I am doing, number 11, the atresia of the conal area, the back of the nasal cavity, I'm actually getting CBCTs before I do the nasal release. One, because I'm a dentist. but I want to know if there's any strangeness, because at least I can talk to them about it. Like one of them recently, the inferior turbinate, it says 0, that there is no concha, no space around it because it's fused to the floor. So it's going to hurt. When I do, it's going to hurt. And I'll probably get into the middle area concha better than the inferior, and it's on the right side. But I know it's going to do well. So little subtleties. And I've been reviewing some of the Dr. Tamimi's CBC textbooks on nasal and TMJ, and looking at all the different possibilities of formations and what to look for and symptomology. Just that. Now, let's talk about the research. Dr. Cynthia Stein, Dr. Jennifer Hobson.
Well, there's been very little done. Everybody knows that this is a big issue now, this chronic traumatic encephalopathy, which was discovered by Bennett Omalu about, 20 years ago in Pittsburgh, actually, where I used to have my practice. What you're seeing here is a normal brain on the left and one with CTE on the right, causes tremendous shrinkage and loss of big holes in the brain. And I don't know if anybody heard this. I'm a Pittsburgh Steelers fan. Franco Harris just died. Did you hear that?
No, I didn't.
You know who Franco Harris is?
No.
The Immaculate Reception. He's very famous for what's called the Immaculate Reception. It was a game where he caught a ball and the Steelers won at the last minute.
And you know what, Cindy? He's a few days short of the 50th anniversary of that from 1972.
Yes, he was 72 years old and very famous in Pittsburgh, Pennsylvania. But I hope he had made arrangements to donate his brain. It'll be interesting to see if he had CTE. So, but you know, this is a big problem, a huge problem right now. That's almost all the NFL football players' brains that are in the brain banks have it. And again, you don't know if you have it until you're dead. So it's very hard for me to watch football games now when I think about this problem.
Anything, martial arts, anything. Now it's like,
Yeah.
out. Okay, so Jennifer, do you want to speak about the actual?
Yes, so maybe we can, Martha, do you know how to get off screen for a second or stop share for a moment?
I'll just stop share.
Yeah, stop share so that we can see ourselves a little bit closer. So we are doing some really exciting things. Cynthia and I and Martha and Karen and Andrea Dean, a physical therapist, associate of mine, have done a research project, and we're excited that we are even starting the process of collaborating and trying to get this on the medical in the medical literature. So I'll just say a little bit, and then I'm sure Cynthia, everybody else can add to it. There was 10 patients. We got 10 patients to come. This was in October, and we were able to test 10 patients. Before we actually did the procedure, we used the right eye, this right eye equipment that tracks the eyes and can really measure right and left eye and give you an analysis of the eyes before. Then we did the rhinomanometry that wonderful Dr. Martha Cortes did. And then we also, Cynthia tested their eye tracking in terms of any strain patterns and their neck strain patterns. And also did the nasal release technique. And then we did all of that again. On top of that, there was a Rivermead concussion, form that everybody have to fill out before and after. So do you want to share a little bit with everybody, Cynthia, the results of this?
And one more, and Dr. Karen donated a lot of the disposables for rhinometry, because that was really important. So thank you, Dr. Karen.
Yes, thank
Cindy?
you.
Well, we saw, the strain patterns cleared up. We had 3 MMA fighters, mixed martial arts fighters, that were very, very involved. And it was very painful when I did the procedure, particularly on one of him. He cried. It was so, and I made sure that we did a very good treatment, like I inflated it 3 times. When he stood up and we re-examined his eyes, the strain patterns were gone. He was amazed. what we found in our results, I think the one thing that the next research that we do has to be done with right eye, we saw changes in their fixation. 6 of them changed in fixation, which means their ability to look at an object and fixate their eyes on it.
Now, what is important about that?
Well,
Most
yeah, you
people have
can't, your
concussions
brain can't, if
cannot
you
do
can't fixate
fixation.
on something, your brain can't figure out what you're looking at.
But the concussion people can't do that. That was what was common.
Concussion people can't do that. And that has to do with eye tracking. It has to do with eye muscle strength. It has to do with the brain's ability to interpret what the eyes are seeing. So, and the beauty of right eye, which is an incredible system, is it's a graphic readout that you see of your saccades and your pursuits and your fixation. And you can actually compare it, you know, from one time to the next on the improvement of the person. And the unit can also be used to exercise the eyes. So a person that has this unit in their office not only can test, but they could also, you know, put their patient in front of the computer and it exercises the eyes. People that are concussed can't cross their eyes like you're going to see me do. They can't do it because in order to be able to cross your eyes, all the eye muscles have to be strong. So that was what we saw. It was an amazing, Karen. But the biggest thing that changed, and you guys, the Airway Circle is going to be very excited about this. The biggest thing that we changed was what I didn't realize existed in concussion until these beautiful people came into my radar, Martha and Jennifer and Karen, is we changed their breathing. So Karen will talk about that.
Go ahead, Karen.
What was really interesting, I was sitting in a baseball field and we were FaceTiming and I'm looking at the results. And then I looked at all of the overall results. We also added the peak nasal inspiratory flow meter. Now the peak nasal inspiratory flow meter is very simple. It's clinically comparable and compatible to doing rhinomanometry, but it does not have the pressure component. It only gives you the flow. What was really interesting is that Cynthia was we were sitting at the table and I'm looking at these results, and nearly all of the patients went from extremely obstructed, off the chart obstructed, to within a normal range of nasal function resistance. So what does that mean? Well, let me back up. There was one in particular that caught my attention. Now this was all retrospectively looking at these, and one patient caught my attention that they were high. And then, the rhinomanometry reading, the PNIF reading was high, did the nasal release, and then post-nasal release, it went higher. I said, Cynthia, why did this person go higher? And I was like, a histamine response. Did this person have an allergy?
Latex
latex. And she looks in the chart and she goes, oh my God, they have a latex allergy. That's how detective and sensitive and specific rhinomanometry is. You'll hear a lot of controversial, it's for research only, it's not validated, but it has been over the past 5 years. So this just proves that concept of detection to the changes in the mucosa. It was amazing. But what was most important is, again, this brought people down from extremely obstructed to within normal ranges, which was amazing.
So,
now,
and you know what, Karen, that's never really been looked at like we looked at it.
I was going to say, because
Concussed
I turned around and just kept telling, I said, these are apneic. It's not just concussion. I keep getting severe apneic, moderate apnea. How are they breathing? A 19-year-old, I looked at her, go, do you ever sleep? She goes, I'm up every hour and a half. So every 90 minutes, she's up for another hour to 2 hours. She couldn't sleep. The rhinomanometer test proved that it actually was apnea showing up. It wasn't just mouth breathing. It was apnea. And this has never been associated a sleep disorder breathing. Apnea, it's not just breathing, apnea with concussion people. That it was my conclusion. I was like, you got to look at this.
Yeah, we're going to do it.
That's a very serious thing.
Yeah.
And if you think about the nuclei, the sleeping nuclei, the respiratory nuclei, they're all near each other. So it's really almost demographic issue. It's the land, the area of where this has happened. It was interesting. Go.
Dr. Martha, that's a great point. I was going to tell you. So back in my trauma days, back in the 90s, now I'm dating myself, but I worked in trauma. And one thing that always stuck out in my head was coup contra coup. When the head goes forward, then the brain follows. And then when you go backwards, then the brain follows. And that shearing can create so much damage. But what's interesting is I think dentistry, we need to ask if these patients have ever had a concussion, because the communication from brain to lung is lacking. And what appears to be a sleep disrupted breathing disorder can actually be post-concussion syndrome.
And I want to just say this. You have to remember that you don't have to go out, lose consciousness to have a concussion.
Right.
All you have to do is hit your body or hit your head, and your brain is going to do that. And remember, the concussion is cumulative. Every time you hit your head, more force goes into the skull, and it damages the brain. And an inflammatory response
Renata
happens.
has shown up.
Oh, yes, Renata.
I have lots of questions coming from Facebook.
Okay.
Are you guys okay if I ask them now, or would you like me to answer?
No, we need to do it now
ready.
because we're
timing is perfect.
we're trying to
Okay.
end at like 6:30.
Perfect. So
This is
first
perfect.
question, how young can you do this procedure?
Newborn.
Perfect. I'm bringing my son to you.
So.
Chris is asking, what is the actual technique called and what profession does it?
Chiropractors do it, PTs do it, naturopaths do it, nurses can do it. Anybody in their
Doctors.
practice act that can go in.
Doctors can do it. Doctors can do it. I was speaking to my husband, my being a physician, and it's actually taught in medical school, except they teach it differently. So what happens, each field now teaches it differently. And that's what's going to, I got actually trained originally in 98 when I was involved with the Switzerland group, and because you had to learn how to breathe. But in 98, I was a little shy about going into the nasal cavity at that point. So next question. So there isn't any licensing, but a doctor can, nurse can, and you should have the correct training.
There are some states where chiropractors can't do it in, Georgia being one of them.
I was just going to say
Texas
that now the
being another.
chiropractor does it different. The technique is slightly different than the one
Welcome
that
to Georgia.
Stein is teaching. Go ahead. Next question.
All right, next question, Dr. Hidalgo. Awesome. Any links to what nasal release is? We'll post a link on Airway Circle Professionals group after this live, so you have some more info on it. Anne is asking, where can you find professionals in your area who are skilled in this technique?
My website, conquerconcussion.com.
Perfect. We'll put that link on there also.
And also on the chat. You can write on the chat, right?
Well, they're not in here. Yes, I could write on the chat here, but it won't. Yeah.
Conquer-
Perfect. Those are
conquerconcussion.com.
Conquer concussion.
I have a practitioner referral list on that.
Renata,
All
you
the people
also
I've trained.
mentioned, you had a question on this. I just saw in your chat. What were you asking? You said what kind of facial surgery? Septoplasty for the cranium?
So you guys were talking about the contraindications of this technique, and one of them was facial surgery. A lot of our patients have had septoplasty or nasal, surgery done.
That doesn't mean you can't do it. You just have to be aware that they've had that, and you have to start slow.
Slower
Perfect.
and smaller, and don't agree.
Ease them into the procedure. I have
Perfect.
never
Thank you.
heard anybody doing this procedure. So, but I'm very cautious. I make sure that I start slow. I don't when I had it done on myself by a chiropractor the first time, he blasted me out. And I had scheduled to see him 3 days in a row, and I wasn't going to go back the next 2 days, but something said, no, you better go back. I don't do that way on my patients. The first time I see them, I do one balloon, one inflation.
Could you talk a little bit more about that? If somebody does find a practitioner and they want to get this done, You just mentioned that it needs more than one appointment. How far apart are they? What should they expect?
When people come in from out of town to see me, I do them 2 times a day. As I said, the work is cumulative. So if you do them, and as long as they don't hit their head between a week or a month later, the work is going to stay, expanded. So you can do it as much as they can tolerate.
So since I'm local and my patients are local, I'm actually do it the first time within 3 days to 4 days. First, second. The second, if they can allow me to do one in the morning and one in the afternoon, hang out a little bit, then I let go for a week to 2 weeks. And then I do another 2 set, same way. And it's gentle.
Usually in 5 or 6 sessions, they're pretty good.
I tell people about 5 or 6, really.
Yeah.
And that only came about since I added eye restrictions. When I used to without eye restrictions, I had to do a lot more. So when you do the eye restrictions, your eye position, your eye muscles are assisting to pull the bones back into position along with the procedure.
You are right, because my first couple of cases forgot the eye strain. And then when I went back to them on their second, like, oh my word. And all the rest of them would have been nice and consistent, where now the word is passing where like, I think I want that nasal thing you're doing.
That's one thing that every single person that did this in the study, all of their eye restrictions improved. Every single one of them, their eye pain reduced or the eye strain reduced before after the procedure. So that's a huge thing. I think that that's very important.
Because it didn't happen when I didn't do the eye. I would still see eye strain.
Yeah.
What about? I had a question that was posed to me about nasal function resistance and injectables. Some people, in order to get the deviation of their nose straightened, they'll do like lateral injections, collagen or different bases of injections. What about those? How would that impact the movement?
I have no idea. I'm not familiar with that.
That's a good question for my husband.
Yeah,
Because the thing is,
Martha, I'd love to know the answer to that.
Does it collagen? No, but if it's one of those other injectables, it can move. What if it's, I don't know. That's a good question. Well, we'll put that on the plate for the next one. Next question.
You're mentioning the eye strain. I remember whenever we're in Phoenix and we're looking at everybody who's coming up and we're doing, the eye assessment. And I think everybody had 1 or 2 places that they had eye strain. And I think my case, I had it in every single direction, almost, the eye strain. So I cannot wait for you guys to see my case. I know everybody here is going to be following. You guys know that I'm going to be posting everything that I'm doing. That's Benny. Year 2023, I've been taking care of everybody. I've been getting my kids and my patients. So I am going to do it. I start expansion sometime next year. So I want to do the nasal release. But I'll be sharing everything with everybody in case you guys want to follow along. I know there's a lot of people on Facebook watching this also. And just as a reminder, every other Wednesday now, the Beauty of Breathing podcast is going to be going live right here. So put that on your reminders, on your calendars, so you don't miss it. And I'm so thankful to Dr. Jennifer Hobson and Dr. Martha Cortes, who are coming over here in their free time and giving us so much information and bringing incredible guests. So thank you guys so much. This is so helpful. We are all working in this together. So if you're not an Airway Circle member, please, support us. We offer tons and tons of free information, but also we have the membership that you can get to see our previous webinars that we do on Thursdays. We have a research folder. We have so much stuff that we're putting out there to get all of the professionals in this field to work together and to learn together, so we can help more patients. So thank you guys so much. It's a great way to end our year.
It's awesome.
How do we access this? Because there are people that couldn't get on and they want to be able to access it. How do they do that?
Yeah, so right now I have everything available in our Facebook page and Facebook group. So if you're not a part of Airway Circle Professionals on Facebook, join us. That is free. It's another thing that Airway Circle offers, is that community where you can go get information, ask questions, find a provider to collaborate with around you. So it's over there. You can just look it up. But I'm also recording this and it's going to go into the membership. So if you're a member, you're going to have access to everything.
Membership access. And if you're not a member and you go into Airway Circle, what happens?
The Facebook group, Airway Circle Professionals on Facebook.
Airway Circle Professional.
Yes.
Airway, okay.
Yes,
Hi,
Airway
Dr.
Circle dash Professionals.
Hi, Dr. Cortes.
Hi,
Hi. Are you teaching
Okay.
nasal breath?
Cindy Stein is the one who teaches it.
I
And
see.
he
Hi.
does a Zoom teaching on the nasal release, and you learn it on yourself.
Oh, I
And
see.
brilliant. It's brilliant because I end up doing 2 releases 3 weeks in a row per week. And by the time I got to the 6th release, I was walking around. I'm going, oh my God. I breathed in and I had, what's that, burning nose syndrome, where you have too much space. Like they used to do
Empty nose syndrome.
empty nose syndrome. And it was burning. I had burning pain. I'm going, oh my word. And so now I ate pasta, I ate bread, and I'm not getting my nasal. I used to shut down because I'm also asthmatic, shut down. I couldn't breathe. I would like, and now I'm like, oh, pasta, oh, bread. I ate a dairy and I'm going, that's, so it was mucosal swelling. So my diet has changed right now for a while because it's the holidays. I'm enjoying it. And nasal release helped me be able to enjoy more. And that's what I have to say.
I was going to ask about that. As soon as you started talking, I was going to ask about empty nose syndrome.
Yeah.
Cindy.
Oh, if you can do it with the empty nose syndrome.
I feel that if you do a lot of meditation, they require deep breathing, either pineal gland breathing, that's pretty difficult. But if you do a lot of meditation breathing, there's a Wim Hof breathing, there's a Boma breathing that kind of can increase the nasal release, nasal passage too.
Can you please introduce yourself? Is it Dr. Chan?
Sorry,
Yeah, Dr. Chan speaking.
I'm a dentist. I'm in San Diego. I don't know. I just came in.
Vincent.
Maybe I was late, so I didn't know. Dr. Stein was teaching that
I
nasal
have 2
release.
spots in a class on January 3rd. If you want to join, to get into that class, you got to let me know real soon though, because I have to send the supplies out to you.
Who is your information?
ConquerConcussion.com. If you go on that, you can register. You can register for the class, and then
Okay.
I'll call you and I'll get your address and stuff, and we'll send it out to you.
Are you
Perfect.
chiropractor or dentist? Or, sorry,
Physical
are you
therapist. She's
chiropractor?
She's
MD, or-
a physical therapist.
I'm a PT.
Oh, I see. Okay,
Dr.
great.
Chan, we're going to put some more information in our Facebook group, Airway Circle Professionals. Make sure you join our group and you're going to get all the info right there. Dr. Cindy, sorry. How often do you do these courses?
I typically do 3 or 4 or 5 a month,
Okay,
Oh,
perfect.
and they're weeknights.
Perfect. And how long?
They're 6 to
How
10
many
o'clock
hours?
p.m. Eastern Standard Time.
Perfect. So I'm going to add some information and the website in our group. If you guys are not part of it, please join. And then you guys can contact Cindy from there and get scheduled to take the course. Okay.
sorry, is that aerial circle? AER?
Airway.
Airway circle. Okay.
Airway, like the airplane. Yes,
Got
but it has nothing to do with airway.
Dr. Chen, I'll send it to you.
Okay,
There
thank
you
you.
go.
I have her on my WhatsApp.
Perfect. All righty, guys.
Thank
is it.
you. Thank you again for the opportunity.
Seeing everybody.
was
Thanks
such a
for
pleasure.
listening to me.
Really,
Thank
really
you for
appreciate it.
information.
So nice to
Happy
see everybody.
holidays. Happy holidays,
God bless
everybody.
everybody.
And a wonderful 2023. It's going to be great next year.
It is great already. Thank you.
Thank you.
Bye,
Thank you.
guys.
Bye.
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 Thank you for listening to the Breathing Lab with Dr. Jenny.